My name is Hope Frost and I'm delighted to welcome you to this podcast brought to you by SBK Healthcare, who provide dedicated training for NHS professionals. If you enjoy this episode, please do visit our website at www.sbk-healthcare.co.uk. Find out about further educational podcasts, webinars and interactive forums. I am now pleased to hand over to your podcast guest for this episode.
Hi, I'm Louise Porter. I'm the National Lead Nurse for the Burdett National Transition Nursing Network. We work with many professionals across the country to help improve transition pathways for young people who are moving from a children's service into an adult service when they've got a long-term condition.
Hi, I'm Donna Hilton. I'm the Youth Service Manager at NUH Youth Service based at Nottingham Children's Hospital. I've got over 20 years experience in health-based youth work, and I also chair the National Health-Based Youth Workers Group. I've got a big interest in healthcare transition and do some support for the Burdett Trust in terms of youth work advice and input.
Thanks, Donna. Donna, there are some professionals out there that say they struggle with talking about things like sex, drugs, alcohol. What would you say to advise them on how to start a conversation?
Firstly, for me, I think they shouldn't treat them as taboo subjects. I think it's interesting when we've spoken to young people about these subjects, they always feel more comfortable talking to their doctors about that than the other way around. And I think, but obviously that's not across the board. There's some doctors that have some excellent conversations with young people around these subjects. But for me and for young people, they don't treat them as taboo. And linked to that is, I think we shouldn't assume that young people will or won't engage in sex, drugs and alcohol because of their condition or background. We've had experiences, for example, where we've had workshops around sexual health, and some healthcare staff have said, oh, you need to maybe tame that down. And we have young Muslim women in that may not, parents may not consent to that. Or we've had young people in wheelchairs and people assume they're not interested in sex. And actually, it's very much the opposite. Young people do want to know about these things. And it's important that they do, no matter what their background or position or health condition. So they're the starting point. So don't assume people will or won't want to know these things, and don't treat them as taboo. I think we need to be non-judgmental and provide a space where young people can talk openly and be honest. Young people do want you to listen, but they also want advice. And it doesn't mean that we know that advice. I think it's important to have a bank of resources and things that we can tap into and know where to signpost young people. For example, locally, we have something called a C-card scheme where young people can sign up, have confidential advice from people that are C-card trained, and they can get free condoms. But it also, protects young people for safeguarding. It's a very safe scheme. And it's where young people can talk and express themselves confidentially. So things like that are really helpful. It's also having resources. If you have youth workers in your trust or settings, we can make things a little bit more exciting. We use things like board games and different resources. It could be anything from turning a game of Jenga into a discussion about drugs and alcohol. We have different props and things, beer goggles, all hands-on things that make young people engage really well. Board games we've turned into things like Sexual Health Millionaire and the Sexual Health Chase, and young people respond to these because it tends to have a more creative focus. You're not focusing just on that sexual health issue. So things like that are really helpful to have links to. And training, I think for me, training is about refreshing. You could be delivering sexual health or alcohol and drugs workshops for years, but I still need to keep my training topped up. Training doesn't mean that you're failing. It means that you need to be up to date with what's happening. We were in a workshop recently, and well, a couple of years back before COVID, and young people were talking about blue waffles, and we thought it was something on the pancake menu at the Pancake House. So, there's always new terms that young people are referring to. You definitely didn't want to see a picture of a blue waffle, but these are the things that we need training for. Another example, we were in a workshop recently, and young people asked to be introduced by pronouns, which is really important in terms of gender identity. And some healthcare staff were really unfamiliar with that. And when we suggested training, they were really defensive and think, well, we don't need training, we've had it. But everybody needs training, no matter how experienced. So don't be afraid to link into places. We've got
That's a really important point about gender pronouns as well. And I think a lot of professionals get a bit caught up in the worries of getting it wrong. And I know that young people say it's okay to get it wrong, and they'd rather that you tried and got it wrong and just acknowledged if you got it wrong and just apologised, but actually ask them how they want to be addressed. Is that your experience as well?
Yes, absolutely. And I think it's harder. But not excusable for people that have looked after these young people for a lot of if they've had a long-term health condition for most of their life, and people have known them as a former name or a former pronoun. It is harder, but it is really important. And young people, if you do get it wrong and you do apologise because you've known them as a former name, that they much rather you be honest with them than shy away from it. And I think, that's a really good point, Louise. It's really important to be constantly getting these things right and getting support around that, as I say, through training.
Yeah, I think it's more about trying, isn't it? So Donna, just thinking about young people and lifestyle issues, what kind of lifestyle issues do you think that they might face that, professionals could help with?
So starting off with, identity for themselves, and that not just around gender and sexuality, but who am I, acceptance of conditions, that sort of thing. So young people have a lot of pressures through lifestyle, school, community, college, work about fitting in. They don't want to be different, particularly if they're taking medication and things like that. And I think there's a massive thing around mental health, emotional health at the moment, and stress. And young people, I think, want that taken seriously. Well, it should be taken seriously. Everybody wants mental health taken seriously. It's not I hate to say it, but some people might think, another eye-rolling moment because a young person needs to offload about their crisis as they may be in. These are really part of who young people are and who everybody is. And COVID in particular has heightened that to the point where a lot more resources and things need putting in place for young people's mental health. So that's huge at the moment. And I think we can be ears, and healthcare staff can be ears for young people. That clinic might be that time where just listening to a young person, having a smile and saying, take your time, that could make the whole difference in a young person's day and what their next steps are going to be and how they react. So a lot of that risk taking is linked with that, social media, all of these things that heighten young people's experiences at the moment. So I think being aware of what young people are facing at the moment and knowing the sort of risks that are out there, the trends that are happening within young people. Again, sort of having that listening ear to support young people, knowing where to refer them on to. Do you have, if you don't have youth workers in your trust, do you have community resources, or just knowing of online things that young people can go to? Do you know about COOth? Do you know about other things locally? And organisations that you can link up with young people. I think that's really important to know that, so you can support them with their next steps.
Yeah, I was just thinking, Donna, I'd heard quite a bit about social prescribing, and when I looked into it a little bit more, I found that social prescribing was a really good way of getting to the root cause of some of the problems with young people and helping them to signpost them to the right organisation as well moving forward. Is that something that you would recommend as well?
I think social prescribing is brilliant for that. They are people that are in place specifically to help signpost. As healthcare professionals, whether you're even as youth work staff or nurses, we can't do everything for young people. We've got to know who that team are around us, and social prescribers are brilliant in finding and linking all of these people together, so young people can get the care and support they need. So definitely, yeah, social prescribing is a fantastic way of making that happen, really.
Yeah, and I think you can find them in a variety of settings as well, can't you? From GPs to community settings as well as hospitals.
Yes, yeah, definitely. They're out there in the community as well as hospitals, yeah.
Yeah, I was interested what you were saying about mental health as well, Donna, because some young people that we were talking to were saying, actually, mental health is a huge issue and it can be fleeting. It doesn't have to be a diagnosable condition. Sometimes you can feel really quite depressed, and then sometimes you can feel okay. So, it depends on what day you see a young person on as well. And they also said, through that transition process, just giving them a lot of reassurance can actually prevent a lot of mental health problems, because actually the anxiety and panic about going to an adult service can make them feel really quite unwell. So they said, please do remember that it doesn't have to have a diagnosable condition to say that somebody has got mental health problems.
Absolutely. And I think we need to be in the way we communicate with young people. Transition is a scary time for young people. So if we can look at supporting them, and even if it's, anything from going to their first appointment with them, and I know our youth team have supported a lot of young people that way in transition to help anxiety. But it's also, in terms of their lifestyle, they've got all of these, you talk about lifestyle issues with young people, and this is for every young person out there. For young people with health conditions, they've got all the added pressures of managing that on top. And I think young people are going to forget their medication. They are going to potentially take risks. And I think we have to change the way we communicate with young people, in terms of, they know their medication's important. They know it's going to keep them alive or keep their organs longer, or whatever they take their medication for. But it's maybe changing that approach, in the fact that, okay, what makes it hard for you? When are the times you do miss your medication? Not you must take your medication. I think that just sometimes the way we communicate with young people can go a long way in helping them sort out those issues, rather than putting pressure on every time they're in clinics to, take their meds or do this, do that. They know this stuff. They just need a space to explore the times that they struggle with that. So I think it's really important to highlight that point.
Yeah, I think that I really agree, Donna. And I think that, young people can't necessarily change the way they are, but we can change the way we are. And I find that, using motivational interviewing techniques, if anybody hasn't done that training, it's really fantastic training for changing the way that we frame a conversation with patients, particularly with young people, so that they come up with the solutions rather than us telling them what to do. It's actually having a conversation with them, because like you've just said, Donna, they know what they need to do. They've been coming to clinic for years. They know the importance of things sometimes. So actually what we need to do is work out with them, actually, what are the kind of things that are going to be able to help them to move forward and adhere to kind of treatments and regimes going forward, and taking medications and keeping on track. And yeah, I do find motivational interviewing techniques are great for that. So looking for kind of that change talk within the conversation that you're having with them. So where they're saying things like, well, I would if I could, but, what is that but? What's the thing that's stopping them? What would be the thing that would help them to re-engage with their healthcare and move it forward? And sometimes it's using the people around them as well, isn't it? I always remember speaking to one of the youth workers that I was working with, and he talked about a young patient who had diabetes, who had been working with for a number of years and trying to change the way they were viewing their kind of insulin taking and making sure that they were keeping the sugars on track. And he said he was really struggling for years, and then all of a sudden there was this breakthrough, and it seemed like the penny had dropped, and they were kind of taking much better care of themselves, and their HbA1c was really stable, and they were doing really well. And unfortunately, on that occasion, it wasn't the youth worker that had made the difference. It was this young guy who'd got a girlfriend, and the girlfriend had made the difference. So I think it's just thinking about the people who are around them as well. So thinking about who are the big influences in their life that we can actually help to use to help them to change their behaviours as well, to make it, so that they've got much more positive health outcomes.
Yeah, that's a really good point, Louise. Definitely. Brilliant. Okay, Louise. So question for you is, some professionals feel awkward about difficult conversations. We've touched on this before, that sometimes it's young people that feel more comfortable, but what advice would you give in this situation?
I think as a professional, I'd always kind of keep in the back of your mind that that young person's feeling way more awkward than you are. And it might be something that you're not feeling comfortable with, because it might be something that you don't usually talk about. So, you know, some people say they struggle with kind of even talking about careers and saying, you know, it's not my area of expertise. So actually, how would I talk to them about it? Because I don't know where to signpost them to. And I think that's the biggest barrier, is starting the conversation and then not knowing what to do with that information. So I think if you always start kind of that mindset of a conversation around, you don't have to solve all of these issues. It's about having the conversation with a young person and then helping to signpost them to the appropriate person who might be able to help them. So I think that really helps kind of calm you down a little bit as well, and just think, this isn't my sole responsibility. Actually, all I'm trying to do is find out what is going on with this young person to be able to help them move forward. And I'd use kind of tools. So if you feel really, really, you know, difficult about having that conversation, so like, how do I start that conversation? Like, you can't just go into consultation and say, you know, let's talk about sex today. That's going to be really difficult. It's thinking about who's in front of you. So do you know that patient really well? So do you know that young person? Have you been seeing them for a long time? Sometimes that makes it better, sometimes it makes it worse. So where you've been seeing them from birth, sometimes it's a bit of an awkward conversation, because you think, no, I've known you since you were 5, and it's like talking to your parents about sex, isn't it? So you might not be that appropriate person. So you might want to think about, actually, is there somebody else in the team that would be better having that conversation? But actually, if you know them well, it might be easier to have the conversation, because actually you've built up a relationship. So it's a trusting relationship, and they feel more comfortable with talking to you. So I think it's about thinking about who's in front of you and what kind of relationship you've got. But also, if you feel really challenged by opening that conversation, it's about using the tools that are around you. So there are documents out there that we can use to frame a conversation. So some of them are like the Ready Steady Go program for transition. There's the HEADS assessment. There's the Great Ormond Street version, the Growing Up and Gaining Independence. So I have had professionals say to me that, actually, you know, when it's on a list, on a sheet, it's much easier to start that conversation, because it feels like you're not picking on that person. You're not actually saying, you know, I'm asking you this because I think you've got a problem with it, or I'm just asking you. I think you need to normalize it and be part of that transition process. So if you explain what transition is to these young people, so part of the transition process is, you'll have an opportunity to talk about various different things. You might have an opportunity to talk about that without your parents there, if you feel more comfortable, or you can have somebody there if you feel more comfortable with a bit of support. You know, it might be another professional rather than a parent, but it's about normalizing that conversation. So you're not picking on an individual. Everybody has the opportunity to talk about that. And then if you use a kind of either a checklist or a sheet, or, you know, transition program like we've just mentioned, like the Ready Steady Go, what you're doing is giving them the list of what you're going to be talking about, and then they can decide to tick the box to say, I need more information about this. They've already then opened that up to you to say, actually, I do want to talk about this. Or if they've ticked it to say, I understand and I don't need any more information, it's still on the sheet, so you can still have a conversation about it. So you can still say, oh, you say that you've got enough information about that. Can I just check what your understanding is about X, Y, and Z? And then that kind of starts the conversation. Another way you can do it as well is not talking directly to that young person, so talking a bit in like third person, so saying, actually, you know, what we find with some of our young people is that they struggle having these conversations, or they might struggle with sexual health because of the condition. They might talk about you know, fertility, or they might worry about whether you're going to have you know, children at a certain point, or you can't, you might need help too. So it's about talking about other people, not them. So then you feel like you're not directing the conversation to them, that's making them feel awkward, that then in turn makes you feel awkward. So it's kind of taking out that kind of finger pointing moment and actually talking about it as a general conversation about other people find that it might be difficult. I don't know how you feel about that subject. So you're opening it up to them. I would say you always need to check in with them as well, just on when you should be bringing up those subjects, really, because it's difficult, you know. So getting the right age and stage of development can be hard. So we usually say that, you know, within the transition path where there is certain points where you might want to start those conversations. So kind of at that 13, 14 age group, you might want to start seeing them on their own, giving them an opportunity to talk on their own. So that might be around them kind of practicing asking questions without the parents in the room. But it's also about, giving them an opportunity to say something when the parents aren't there. So it might be something they might feel embarrassed about, or something they don't want to say in front of the parents. So it also gives an opportunity for some of these harder to have conversations. So there are kind of guides around the age range that you might want to bring up these subjects, but actually what young people tell us is check in with us on a regular basis, because actually when I get to 13 I might not be ready, but at 14 I might be. So please do ask us, and then we'll let you know if we're ready or not. And also asking them about those difficult conversations as well. Is that something they want to discuss?
I think that's a really good point. I think the fact that to keep checking in, because if you do get the timing wrong or it's not right for the young person, it might then put them off having those conversations. But if, as you say, if they know it's part of the routine and the checkup, then they know that actually, I am ready now to talk about it. So I think that's a really good point. And Louise, following on from that, where would you access resources to support, or where would you suggest healthcare professionals getting resources from to support them? Obviously, you mentioned the Ready, Steady, Go and HEADS assessment, but would there be anything else, any links or anything that you know of that people can access?
Yeah, so I think it's about using the people that are around you as well to gain information on where those resources may be. So we've mentioned kind of social prescribing, haven't we? GPs is always a really good one to signpost young people to, and I don't think we use GPs enough, particularly in the children's service. We try and solve all of our problems rather than referring them on to the people who are used to that. That's their bread and butter. They deal with that all the time. Some of the resources that we used as well were public health libraries. So where you need leaflets, I know it's difficult in COVID times, but pre-COVID, where we had leaflets in racks and in departments, public health library was a brilliant place that you could go to where you could get leaflets on anything. And some of the things that you were talking about, Donna, as well, around games on various different things, from a public health point of view, they have everything, don't they? So if you're setting up transition events or transition evenings or kind of group sessions, then that's a brilliant place to go to gain resources to talk about certain different things. They have different kind of racks of kind of different e-cigarettes and things, don't they, to talk about those, because e-cigarettes is a new one, isn't it? We talk about smoking, but I don't think we talk about e-cigarettes as much with young people. And some of the different types of drugs, and then opening that conversation for interaction with drugs and prescription medications as well. And like you say, Donna, we have young people that will say, don't assume just because I'm in a wheelchair that I'm not going to do some of these things, because I'm entitled as much as anybody else to kind of take risks and do all of these things. So I think there would be some of the main places, but also using the other staff around. And I think particularly when we're working in hospitals, we forget to talk to the other services. So look at what other services are doing around transition, look at the events or evenings that they might be having, try and work collaboratively with other teams, because where you've got a young person with a long-term condition, it doesn't necessarily mean the issues that they have are going to be specific to just that long-term condition. Some will, but a lot of it is commonalities, isn't it? So where you've got a long-term condition, you can actually empathize and sympathize and see the kind of parallels with other services as well, can't you? So other people with other conditions, if you've got a long-term condition, you've got a long-term condition. So there will be, similar issues and challenges that they will face.
Yeah, I think that's we find that with certain some of the groups that we do. With young people, they might have a healthcare condition, and sometimes it's just knowing, it doesn't have to be the same condition, but knowing that some of the issues and concerns and anxieties around transition or healthcare are there for everybody, which is why the peer support groups and life skills programs are really great. So if people have got access to those, either through youth workers in their own trust or community groups that can support these young people with those life skills and needs, then it's great. I think at your trust you were doing the Duke of Edinburgh, and things like that for young people are, they're priceless. They're just great to get them together so they know that they're not the only one that might get a dosette box out for pills, and just knowing they have something in common just might help them take a few more steps forward towards that healthcare transition. So it's great.
Yeah, and I suppose that kind of moves on as well, Donna, talking about the Duke of Edinburgh's award, it moves on to kind of rewarding young people for the work that they're doing, in transition, learning their kind of medications and their treatments. It might be, they're on dialysis and they're learning really complex tasks, aren't they, to self-manage their condition. And that can be used through various different schemes. So if they're doing the Duke of Edinburgh's award within their school, perhaps, the skill section of that could be part of just self-managing their condition. So they're already doing it. So it could be signed off as a bit of a reward for, and something to get something back, an actual qualification almost for the work that they're doing within transition. And it might just help with adherence and a recognition that actually, the learning is, kind of comparable to kind of GCSE and almost degree level sometimes, isn't it, the work that they're doing?
Absolutely. And in a similar way, we use the AQA scheme, which is an accreditation scheme. And the joy is, we've worked with healthcare professionals to write own units. So, for example, we've written one with the diabetes team for when a young person's in hospital for stabilisation. Ones have been written for young people helping to set up dialysis machines and things. So you're right. So them taking an active role in their healthcare and getting the accreditation. Not all young people are driven by that, but young people, especially those that may, have missed out on a lot of schooling due to treatments, they want to gain their accreditations as well. So it does actually work. And young people do engage with that, which is brilliant.
So Donna, I'm a massive advocate of youth workers, and I would hope that everybody would have one in their organisation. But if they don't, there are other youth workers out there, aren't they? So where would they find other youth workers?
For those trusts that have them, great. For those that don't, I know some hospitals out there, we get calls from people that are linking in with their local community youth workers. I think a lot of council youth workers are a thing of the past, but there are charities and community youth workers out there that do want to get involved in healthcare. So it's always worth contacting and finding out who's in your community, what youth workers are out there. At the end of the day, you've got a cohort of young people that actually are, entitled to have access to youth work. And if they haven't got it within the hospital, then can partnerships be set up in the community for them to come in and help deliver programs and particularly around healthcare transition, life skills, helping things with C-card or equivalent schemes for sexual health. I think it's really important that they have that link. And sometimes it's doing a little bit of digging to see what's out there, but it's certainly worthwhile. Obviously I'm from a biased point of view. For me, I could probably write a book on the impact that youth work has had on young people's journeys through health. There's so many different outcomes through bringing young people together, through accreditation, through feeling more accepting and confident about living with and managing a health condition, to managing medications, to being peer advocates for other young people. The list is endless, really, for just self-esteem levels, everything. So it's definitely worth looking into. And if you can get funding and work towards them in your own trust, then that's, there's a lot of people out there that can support you with that. There's many hospitals through the transition network that have now got youth workers. But certainly look into your local communities as a starting point, because there will be something that hopefully they can come in and deliver programs for you.
Yeah, and if we don't have a youth worker, there's still lots that we can do, isn't there? I think for me it's around asking the young people. I think that's the best starting point, is ask them how they feel about things. Starting with the basics of what's going on in their life, what are their goals and aspirations for the future. Get to know them and understand them, and then you can build that relationship and then start the conversations about some of the more tricky subjects really that need to be addressed, because when you transitioning a patient from children into adult services, you're not just transitioning their condition, you're transitioning a whole person. So we need to look after them in a holistic way. And I think it's about just, setting out the expectations of what transition is, making all of this really normal. It's just normal and usual and what we do all the time, and giving them space to talk and to think, and making sure that we are open and accessible for them, and that we're somebody that they can come and talk to, even about the embarrassing subjects.
Absolutely. And I think that's spot on, because, you know, as youth workers, we're never going to reach 100% of young people, and some people will prefer to talk to a nurse, or, you know, somebody that they've built up a relationship with in their healthcare team. So it's providing that space, and giving young people a voice. Nobody knows themselves better than the young people. So if you've always got an ambassador, a champion that, you know, can vouch for young people, that can advocate, that can maybe lead on a youth forum or something like that to give them a voice, that doesn't have to be a youth worker. And if you don't have one, there'll be other people in the trust that can champion young people's health. So maybe that's the thing, young people's health champions, and working together, that can be a whole multitude of roles, which would be really beneficial. So definitely. Thanks for listening. If anybody needs any further support around youth work transition, then obviously please get in touch.
Thank you for listening to this podcast about transition. I hope it's been useful for you and given you a few hints and tips. And please do get in contact if you need any further advice or support.